Good day everyone! Once again, I am Riza Agapi Siyabut, a BS Nursing Student Level 1 Section C of San Pablo Colleges, and for today I am going to show you the proper procedures of changing an unoccupied bed and occupied bed. The main purposes of bed making are to prevent complications by ensuring comfort and security to the patient, to provide rest and sleep, to prevent bed sores, to give unit a neat appearance and cleanliness, and mostly is to decrease pathogens in the patient's environment. Before we proceed to the procedures of unoccupied and occupied bed making, let me share to you the guidelines and reminders before everything. Number 1 is to hold soiled linen away from uniform. Second, linen for one client is never, even momentarily, placed on another client's bed. Third, place soiled linen directly in a portable linen hamper or tucked into a pillowcase at the end of the bed before it is gathered out for disposal. Fourth, do not shake soiled linen in the air because shaking can disseminate secretions and accretions and the microorganisms they contain. Fifth, when stripping and making a bed, conserve time and energy by stripping and making up one side as much as possible before working on the other side. Sixth, to avoid unnecessary trips to the linen supply area, gather all linen before starting to strip a bed. And lastly, do not forget to wash your hands thoroughly before and after handling client's bed and the bed linens and so on and so forth. And so, without any further ado, let's proceed to the procedures of the unoccupied bed making. An unoccupied bed is made when the client is not confined in bed. And in this bed, all linen beneath the bedspread is fully protected from dust and dirt until the admission of a new patient. The purposes of making an occupied bed are: first, is to be ready for the next occupant or patient. Second, is to prepare the bed for the client's return. Third, is to provide a clean and safe environment for the patient. And lastly, is to minimize the source of infection and skin irritation.
For the preparation, determine what linens the client may already have in the room.
Good day, ma'am. I'm Riza Agapi Siyabut, your student nurse for today from San Pablo Colleges. So, ma'am, I am going to do your bed po, or perform bed making. Is that okay to you, ma'am? Okay po, thank you. So, ma'am, may I know your name po? Okay. How about your birthday, ma'am?
July 16.
Okay, thank you, ma'am. Nice to meet you, Ma'am Adin. So, ma'am, first, I will begin gathering all the equipments and perform hand hygiene. Is that okay to you, ma'am? Okay, thank you po. I have already introduced myself to the patient, explained the procedures, and asked for her consent, verify for the client's identity, and provide her a privacy. The next thing I will do is I'm going to assess and assist. First is I'm going to assess whether the patient is able to stand up or unable to stand up. If the patient is able to stand up, then I will assist the patient to sit on the chair so I could perform bed making. So, Ma'am Adin, are you able to stand up po? Okay po, wait lang po. So, we'll have you sit now. Here. After that is I'm going to gather all the linens and I'm going to place them on a clean surface of the room in the same manner in which they will be placed on the bed. And I'm going to make sure that the linens do not touch my uniform to avoid contamination. And for body mechanics and safety, I will adjust the bed to a comfortable working height and lock the wheels of the bed. And after that, I'm going to perform hand hygiene and don a pair of gloves. The next one is to observe or check the bed linen for any item belonging to the client. And then place them in a secure place of the room. And then we're going to lose all the bedding systematically, starting at the head of the bed on the near side. And now we were going to remove the pillowcase. And place it on the center of the bed. And we will place the pillow on a clean surface of the room. And next is we will be folding the reusable linen into fourths. And then place it on a clean surface of the room. And then the next one is we will be folding the soiled linen inwards by rolling it over inwards. And then we will be putting this or place this on a hamper or linen barrel. After disposing the soiled linens in a linen hamper, I'm going to remove the gloves, perform hand hygiene, and after that I will be wearing a new pair of sterile gloves. And then we were going to disinfect the mattress and wipe it from the farthest to the nearest. And then remove the gloves and of course perform hand hygiene. And then the next one is we will be placing the bottom sheet and unfold it.
And so in bottom sheet, this side should be exposed, which is the stitch 1. While in top sheet, this side is the one which is to be exposed.
And then we were going to tuck the bottom sheet under the mattress or the head of the mattress, and we will going to miter the edges. and then the rubber sheet.
And then the draw sheet.
And then we're going to apply the top or complete the top sheet and the blanket. And then we're going to tuck in the top sheet together with the blanket. And now we were going to miter the top sheet together with the blanket. Make sure that this is wrinkle-free. Afterwards, we were going to move on the other side. And we will going to fix this side by pulling the bottom sheet first. And then the same as we did on the other side is we will going to do it also on this side. So we're going to tuck the bottom sheet under the mattress. And then we will going to miter the top edge of the bottom sheet. And then pull the second is pull the rubber sheet and also the draw sheet. And tuck them also under the mattress. And then pull the top sheet. Also the blanket. And then after that, tuck in under the mattress. And then also miter the top edge. Make sure that the linen are free from wrinkles or wrinkle-free. The next one is we're going to fold the top sheet together with the blanket towards the bottom sheet of the mattress to create an opening. This will now become an open bed. And then the next one is we're going to change the pillowcase of the pillow. So now we have here the pillowcase. The first thing that I have to do is to fold it in half from the opening. So you will going to invert it. And then you will be going to place your head on this side and then invert it. And then you're going to grab the pillow and then cover it completely. Make sure not to shake the pillow. And then we were going to place it on the bed. Make sure that the opening of this pillow do not face the door. So, on my area, the door is on that side. So I will be placing the opening of the pillow facing towards me. Like this. So now this is the open bed. So for us to make a closed bed, we will going to pull this at the top to cover completely the pillow. So now, as we cover the pillow completely, this is now the closed bed. And then, the next one is we will going to provide the client's comfort and safety. And for the last procedure, we will going to document and report the pertinent data. And then, we will going to expose the side cleaner in the paper. And first, we should wear gloves. And after that, we will perform hand hygiene. Okay, so let's move on to the occupied bed making. Unoccupied bed is made when the patient is not able to tolerate or not permitted to get out of the bed, or when the patient is already occupied in bed. So what are the purposes of bed making? First is to change wet or soiled beddings for the comfort and safety of the patient. Second is to provide a change of position and to afford an opportunity to inspect the client's body. Third is to minimize the source of skin irritation. And lastly is to provide a clean environment for the patient. So there are some points we need to consider in an occupied bed making. First is, before starting the procedures, see to it that all the linens are on hand and arranged according to use. Second, if the bed is of the high-low type, adjust the height accordingly to prevent back pain or injuries. Third, finish one side of the bed at a time. We must remember that placement of the rubber sheet will depend upon the client's need and condition. And lastly, we must apply the principles of body mechanics while making the bed or performing bed making. For the assessment, the following are must. Assess skin condition and need for a special mattress, footboard, or heel protectors. Assess client's ability to reposition itself. Determine presence of incontinence or excessive drainage from other sources, indicating the need for protective waterproof pads. And last is note specific orders or precautions for moving and positioning the client. I have done all the assessment and the client has the ability to reposition itself, but the assistance of the nurse is needed.
Here are the equipments to be used.
Good day, sir. I'm Riza Agapi Siyabut, your student nurse for today from San Pablo Colleges. So, for today, sir, I am going to do your bed or perform bed making. Is that okay to you? Okay, thank you. So, sir, may I know your name po? Okay. How about your birthday po? Okay. So, Mr. Oli, it's nice to meet you po. So, first, sir, before I do the bed making, let me first gather all the equipments, the linens that I will be using. Is that okay, please, sir? Okay. And so, I have done introducing myself, verify the client's identity, and explain the procedures, and also provide the client's privacy. The next one is I am going to gather all the linens needed and place them in a clean surface. So again, make sure that all the linen, the clean linens, are not touching your uniform to prevent contamination. And before gathering, you must place all the linens in order for us to be easier to put the linens accordingly. The next thing that we will be doing is to perform hand hygiene and apply clean gloves. After performing hand hygiene and donning of gloves, I will be going to lock on the wheels of the bed. and adjust the height of the bed in a comfortable working height. The next thing that we will be doing is to grab a bath blanket to cover the patient's body. Lower the side rails. And grab the bath blanket. And then, we should encourage the patient to participate by asking him or her to touch the top edge of the bath blanket. And we will be removing the blanket that is covering the patient by folding it or rolling it inwards. And then we must put this linen or this side linen on a hamper or linen barrel. Now we are done taking off the top linen or the top soiled linen and dispose it to the hamper. Now we were going to instruct the patient to move closer to me and move him on a 3 section, the upper, the middle, and the lower. Closer only. I want you to move closer to me. So the next one is we will going to instruct the patient to cross his legs and position his arms and help the patient or assist the patient to move far side of the bed. So sir, we're going to cross your legs. And your arms. And then help the patient to roll over on the other side. So, be moving, sir, on the other side. Ensure the client's privacy and dignity. Make sure that the body of the patient is not exposed. And then we were also going to move the pillow. And then the next one is we were going to loosen the sheet, the bottom sheet, inwards opposite to the patient. Make sure to tuck it as close as possible to the patient. And then after that, we were going to remove our gloves and then perform hand hygiene. And we are done performing hand hygiene and disposing the soiled gloves. And so after changing the bottom sheet and the draw sheet by rolling it over inwards and close to the patient, make sure that the side rails which the patients are being turned towards are being raised to ensure the safety of the patient. So the next thing we will going to do is to put the clean bottom sheet and put this on this side. Make sure to fan fold this edge. And then tuck in the edges. And also miter the edges. Make sure to tuck in it or tuck this sheet securely. And then the next one we will be putting is a rubber sheet. Also fan fold it. And then the next one is the draw sheet. We will also going to unfold it. And then also tuck it in under the mattress. Together with the rubber sheet. The next thing we will be doing is to instruct the client or position the client to the center of the bed. This will be preparing the client to move on the other side or the clean side of the bed. Always ensure the client's privacy and dignity. And then the next one is we will be raising the side rails. This is to secure the safety of the patient. And then we will be moving on the other side. So I'm gonna lower the side rails. And then we will be instructing the patient to again cross his legs and position his arms and roll over on that side or that clean side of the bed. So sir, you will be crossing your legs. And your arms. So sir, I want you to roll over on the other side. Okay, thank you. So again, ensure the client's privacy and his dignity. Make sure not to expose the body of the patient. So after moving the client on the clean side of the bed, I have to perform hand hygiene and don a new gloves. And so, after applying or after putting the gloves on and performing hand hygiene, we are now ready to loose the soiled bottom sheet. So now that we have done moving the patient on the clean side of the bed, we are now going to remove the bottom sheet or the soiled bottom sheet on this side by loosening the edges on the mattress. And then roll it over inwards. Make sure that your uniform do not touch the soiled linen. And after that, make sure, again, do not touch, that this linen or soiled linen do not touch your uniform. And then we will be going to dispose this linen or soiled linen on a hamper or linen barrel. After disposing the soiled bottom sheet linen, we are going to remove our gloves because we have touched the soiled linen and we don't want to contaminate the clean side of this bed or the clean linen. So we will be disposing the gloves. And after that is we were going to perform hand hygiene. After performing hand hygiene and disposing the soiled gloves, we are going to put on a new, clean, sterile gloves. After putting the gloves on, we will be moving on the other side to pull the bottom sheet, the draw sheet, and the rubber sheet. So now we are going to pull the bottom sheet into place. And then we were going to tuck it in or tuck in under the mattress. And again, we're going to miter the edges of the bottom sheet. And then after that is we were going also to pull the rubber sheet. And then the next one is we were also going to pull the draw sheet. And then also tuck under the mattress. Make sure that the sheets are wrinkle free. After that, the next thing that we will be doing is to assist the patient to move at the center of the bed or onto his back. This will be provide the client a comfort. And then we will be going to place or put the top sheet over the patient. And then we will be going to remove the bath blanket. Ensure the client's privacy. And then dispose the bath blanket on a hamper or linen barrel. After that is we're going to put a blanket over the patient. And after that, we were going to tuck it in under the mattress. Also, make sure to tuck the bottom under the mattress. And then modify the edges of the bottom at the bottom of the bed. Next is we must ensure that the linens are tucked securely. And then the next one we will be going to do is to make a toe clip so that the movement of the feet of the patient is not restricted. Next is we're going to remove the soiled pillowcase. And then place the pillow on a clean surface. Clean surface of the room. And then we're going to dispose this soiled pillowcase on a hamper or linen barrel. And then after disposing the pillowcase or the soiled pillowcase, we're going to remove our gloves. And afterwards, also dispose the soiled gloves and perform hand hygiene. Now that we are done performing hand hygiene and disposing the soiled gloves, we are now ready to change the pillowcase of the pillow. So this time, it's okay not to use the gloves. So again, you will be folding the pillowcase into half. And then we will be inverting this edge by putting our hand and invert it under and then grab the pillow. Remember that do not shake the pillow. And so for the edge or open edge of this pillow, remember that do not put the pillow facing on the door. So in my case, the door is on that area, so I will be placing this open edge of the pillow towards me in this area. After all the procedures that I have done, we must ensure the safety of the client by raising the side rails. Raising the side rails of the bed. And then after that, of course, we must perform hand hygiene. In changing an occupied bed, the bed making is not usually recorded. So now we were going to dispose the barrel or linen barrel or a hamper with the soiled linen in it. After that, dispose the gloves, remove the gloves, and dispose it, and apply hand hygiene. So again, I'm Riza Agapi Siyabut, ABS Nursing Student Level 1 Section C of San Pablo Colleges. A quick reminder that before and after all the procedures, make sure you perform hand hygiene. So thank you for your time watching this video and God bless.